Okay guys, I'm recording this short little voiceover that pertains actually to lab exercise 46 entitled Breathing and Respiratory Volumes. And I wanted to just kind of introduce a couple of the different respiratory volumes and capacities explored in procedure B of that exercise. This set of slides we're going to look at today actually comes from the lecture PowerPoint, but they're used again in the lab exercise 46. So what we see here is a patient sitting in front of a device. He's breathing through this tube, and he's being given instructions by the respiratory technologist here as to how to breathe, which she can then record on what appears to be a piece of paper there, which will be included in his file. So in essence, every time he inhales through this device, there's going to be an upward deflection on a pen here on the machine. And every time he exhales through the device into it, there'll be a downward deflection of the pen. So that's the scenario. When he inhales, the pen goes up. When he exhales, the mark would go down on the piece of paper. So this next slide that we're going to take is combining 8 or so different respiratory volumes and capacities as they would be sort of summarized on one of those pieces of paper on that machine that technologist is recording her patient's data from. So when he exhales through the device, the pen goes up. I'm sorry, when he inhales through the device, pen goes up. When he exhales through the device, pen goes down. So we want to talk about a couple of these volumes. The first of which is this one that I will circle sort of in yellow here. This is called the tidal volume. Tidal volume. This is the amount of air that enters and leaves the lungs during normal, quiet breathing. So when you're sitting at home, reading a book, when you're driving to school or wherever, when you are basically inhaling, the amount of air that comes into the lungs, look at the pen, and then you exhale, and you inhale, and so forth, and exhale. So this is during normal, quiet breathing. This tidal volume is typically around 500 milliliters or cubic centimeters, cc's for short. For an average adult, that's pretty typical tidal volume, a resting tidal volume, 500 mils or 500 cc's. Now, if the technician wanted to record her patient's inspiratory reserve volume, she would ask him to exhale and inhale through the device. Okay, a pen would go up and down, up and down, up and down. And then what she would tell him, she would say, rather than stopping an inhalation, as you begin to inhale, instead of stopping to exhale, take as much air in as you can. So what I've outlined here in the green zigzag lines is the amount of air that the patient would inhale through the machine until he could not inhale anymore. He'd get to a certain level that he would have to stop. He couldn't inhale, and he'd have to begin then to exhale. So that amount of air that is in reserve, and again it's an inspiratory capacity, is called the IRV, or Inspiratory Reserve Volume. IRV, or Inspiratory Reserve. Ordinarily, if we had been meeting in lab, we'd be using a small handheld spirometer and measuring a lot of these volumes that we're talking about right now. But of course, we can't do that. So we have to talk about, in essence, the theoretical end of things. Okay, so that's IRV. It's the amount of air that can be inhaled above and beyond a tidal inhalation. We also have what's referred to as the Expiratory Reserve volume down here, or sometimes simply referred to as the ERV, Expiratory Reserve. So this is the amount of air that an individual can forcibly exhale beyond a normal tidal exhalation. Okay, I'll say it again. It's the amount of air that you can forcibly exhale from your lungs beyond a normal tidal exhalation. So the person is inhaling, exhaling, inhaling, exhaling, inhaling, and then the technologist says, okay, I want you to blow all the air out as far as you can before you have to take another inhalation. Okay, that is the ERV, or Expiratory Reserve volume. You'll notice that it's not as much air that you exhale as you could potentially inhale. The ERV is lower than the IRV. If one takes the IRV and adds to that the tidal volume and the expiratory reserve, we'd have something called the vital capacity. Okay, so vital capacity is IRV, TV, and ERV. It's the sum of all of those three separate volumes. How would she, the technician, give him instructions so that she could measure his vital capacity? Well, it's very simple. All she would tell him would be to inhale and exhale normally a few times. And then when you get to a certain point, take as much air in as you can. Take a big, big inhalation. That's what's going on here with the orange arrow. So taking as much air in as you possibly can before you have to exhale. And when you do exhale, don't stop. Keep pushing, 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 pushing before you have to inhale again. That's going to be the individual's vital capacity. And that particular value can vary depending upon your age, your height, and your sex. So if you take a look in your lab manual, there in table 46.1 and 46.2 are predicted vital capacities in milliliters for both females and males respectively. So check that out. You'll notice again that as one ages, the predicted vital capacities decrease. It's a normal part of the aging process. And generally, the taller you are, the higher your predicted vital capacities. Actually, the taller you are, the higher all of these various respiratory volumes would be, because generally the taller a person is, the bigger the lung thoracic cage is, the thoracic cavity is bigger, and you can hold more air, basically. So again, just wanted to kind of introduce some of these topics, some of these respiratory volumes and capacities for you, so that when you get to exercise 46 there in the lab manual, you have a better sense of what those recordings are referring to.